My name is Jenny Cloherty. I'm the Lab Director here in Galway Fertility Clinic. We're a medium-sized fertility clinic in the west of Ireland. We perform between 400 and 500 fresh cycles of IVF every year, in addition to a frozen programme and an ovulation induction programme. We're the only clinic in the west of Ireland, and it's our philosophy to offer the highest standard of care to all of our patients. We now have a team of 5 experienced embryologists and an andrologist and lab assistant. So when I became lab director, I wanted to review all of our systems, and one of the key areas was the incubator environment. So I had a look at lots of different systems, and we wanted to try the low oxygen and a very stable temperature and gas recovery rates. And I came across the EmbryoScope system, which I really thought had the edge on a lot of other incubators. So in addition to it being a very good incubator, the whole time-lapse angle to it, with the capturing the images, the individual monitoring of the embryos, all the extra information that we could get, all of that was quite new to me, but straight away after using it, we could see the benefits. So in early 2012, we started using the EmbryoScope for a few cases, and straight away we saw great benefits. So we invested in a second one in 2013, and for the last year now we have been using EmbryoScope for 100% of our IVF cases, so that everybody can benefit from this technology and incubation system. So from our experience using the time-lapse and the EmbryoScope, we have greater confidence to do elective single embryo transfers, which is something very difficult to convince patients when they're paying for their full cycle themselves. But over the last few years, we have doubled the numbers of cycles where we do an elective single transfer based on all the extra information that we can get from reviewing the time-lapse images. So an additional benefit that we have seen using the EmbryoScope time-lapse system has been as a training tool for embryologists and a learning experience for all of us. We get to review the embryo development in a lot of detail, to go back over cases retrospectively, particularly in light of pregnancies or not getting pregnancies, or when we have frozen embryos that we can select which ones prior to the thaw, and we use that daily in our laboratory. In Galway Fertility Clinic, we're committed to offering time-lapse imaging to all of our patients, and we hope to continue that into the future. I would certainly find it very difficult to work in a clinic that didn't have time-lapse. I think the limited amount of information that you can get from an old-style incubator limits our choices, limits our selection or deselection criteria. So it is our philosophy in Galway Fertility Clinic to provide the highest standard of care to all of our patients. So that is why we have a standard rate for IVF. We don't charge any extra for all the extra things that we know give a higher chance of success, such as using the time-lapse imaging, embryo glue for every embryo transfer. We do extended culture if it's clinically indicated. We feel that all of these extra details give every couple the best chance of success. So we now have cultured over 1,000 cycles in our EmbryoScopes, and on reviewing the data, we have a 34% take-home baby rate from all of those cycles. And that's from our patient population, all ages, where over 40% of our patients are over 38 years of age. They're all using their own eggs, and we hope to continue that success rates using time-lapse into the future.